If you are approaching 65, or if you are already retired and looking at your health coverage, I need you to pause what you are doing, sit down, and listen to me very, very closely. Because the decision you are about to make regarding your Medicare is not just a health decision, it is one of the single most critical financial decisions of your entire retirement. I see so many of you making this choice based on a catchy commercial, or because a neighbor told you what they did. Do not do that. Your neighbor is not you. Your health is not their health, and your pocketbook is not theirs either. Today, we are talking about Medicare Advantage versus Medigap. This is the ultimate fork in the road of retirement healthcare. And if you choose the wrong path, it could cost you thousands of dollars when you can least afford it, or worse, lock you out of the care you desperately need. Let's start with the problem. The problem is that original Medicare, Part A and Part B, does not cover everything. If you just have original Medicare, you have a massive financial gap. Part B only covers 80% of your outpatient medical costs. You are on the hook for the other 20%. And here is the terrifying part: there is absolutely no limit, no cap, no maximum out-of-pocket ceiling on that 20% under original Medicare. If you get hit with a serious illness, 20% of a $100,000 cancer treatment is $20,000 out of your pocket. That is a retirement killer. So, you have to buy protection. You have two ways to do it. You can either choose Medicare Advantage, which is Part C, or you can choose to stay on original Medicare and buy a Medigap policy, which is also called a Medicare supplement. But you cannot have both. You must choose one or the other. Let's look at Medicare Advantage first. The fear here is the $0 premium trap. I know, it sounds beautiful, doesn't it? $0 a month. The commercials make it sound like free money. But let me ask you, when was the last time a private insurance company gave you something for nothing? Medicare Advantage is run by private insurance companies. When you sign up, you are actually leaving the government-run Medicare program and letting this private company manage your care. The government pays them a flat fee to take care of you. So, how do they make their money? How do they offer those $0 premiums? They do it by restricting where you can go and what you can do. With Medicare Advantage, you are bound to a local network of doctors and hospitals, usually an HMO or a PPO. If your trusted doctor of 20 years is not in that network, you cannot see them unless you want to pay entirely out of your own pocket. If you want to see a specialist, you often have to go to your primary care doctor first and beg for a referral. And then there is the hurdle of prior authorization. This means that before you can get an MRI, a chemotherapy drug, or go to a rehabilitation facility after a stroke, a bureaucrat at the insurance company has to approve it first. They can say no. And they do say no more often than you think, because their bottom line depends on managing costs. Yes, Medicare Advantage plans have a maximum out-of-pocket limit, usually capped around several $1,000s a year, but you have to pay copay after copay after copay to reach it. If you are healthy, Medicare Advantage looks cheap and easy. But the moment you get sick, the pay-as-you-go model starts draining your savings account. Now, let's look at the other path, original Medicare plus a Medigap policy, like the highly popular Plan G. With Medigap, you pay a higher monthly premium upfront, often between $150 to nearly $300 a month, depending on where you live and your age. On top of that, you have to buy a separate Part D plan for your prescription drugs. So, your fixed monthly costs are higher right out of the gate. And I know that makes you nervous. You look at that monthly bill and you think, Susie, how can I afford that on a fixed income? If you are willing to risk higher, unpredictable out-of-pocket costs when you get sick in exchange for a lower monthly premium right now while you are healthy, then Medicare Advantage is what you are looking at. During this time, federal law states that insurance companies must sell you any Medigap policy they offer, at the best available rate, regardless of your health. They cannot ask about your high blood pressure, your history of cancer, or your diabetes. You are guaranteed entry, but if you choose a Medicare Advantage plan instead, and then 5 years down the road you get diagnosed with a serious illness and realize, oh my goodness, these copays are eating me alive and my doctor isn't in this network anymore, I want to switch to Medigap. In most states, you cannot just switch, you will have to go through medical underwriting. The Medigap insurance company will look at your medical records. They will see your diagnosis. And they can, and very likely will, charge you an astronomical premium or deny you coverage entirely. You could be permanently trapped in that Medicare Advantage plan for the rest of your life, unable to escape the network restrictions and the high out-of-pocket costs. It is easy to get into Medicare Advantage, but it can be nearly impossible to get out if your health declines. So, what is your actionable takeaway? Do not choose a plan based on the dental, vision, or gym membership perks they throw at you. Those are shiny distractions. Focus on the core coverage. Look at your budget. If you can afford the monthly premiums of a Medigap plan plus a Part D prescription plan, buy it when you are first eligible. Protect your right to see any doctor you want. Lock in that guaranteed issue right while you have it. If you absolutely cannot afford the Medigap premium and must go the Medicare Advantage route, do so with your eyes wide open. Check every single one of your medications against the plan's formulary. Check every single one of your doctors to ensure they are deeply embedded in that network. And start building an emergency healthcare fund specifically to cover the maximum out-of-pocket limit of that plan, because you must be prepared to pay it if a health crisis strikes. This is your life. This is your hard-earned money. Do not gamble with either of them. Be strong, be smart, and secure your retirement healthcare the right way.